Transoral Odontoid Resection. Introduction. Please point to the brainstem.
Choose one of the following options.
Correct. The brainstem is connected to the bottom of the brain. The odontoid process is the name of the first vertebra.
Select true or false.
Correct. The odontoid process is the name of the bony structure in the second vertebra that fits inside the hole of the first vertebra. Slippage of the odontoid against the spinal cord and brainstem is not dangerous.
Select true or false.
Correct. Because the brainstem and spinal cord help the brain control all body functions, the slippage of the odontoid can affect many functions of the body. This can lead to paralysis, weakness, and possibly even death. Fusion of the back of the skull to the neck is always an alternative to taking the odontoid out through the mouth.
Select true or false.
Correct. Fusion may sometimes be recommended by your doctor. However, this is not always the case. A tracheostomy allows the patient to breathe through a tube placed in an opening in the neck.
Select true or false.
Correct. The surgeon may decide to place a tracheostomy to make room in the mouth to help reach the odontoid. The tracheostomy tube is always taken out immediately after the operation.
Select true or false.
Correct. The tracheostomy may have to stay for a few days to weeks depending on the amount of swelling in the mouth after the operation. Some fat and muscle may be taken from the belly or leg to patch possible fluid leaks from the dura.
Select true or false.
Correct. In addition to patching the dura, a tube called a lumbar drain may also be put in the patient's back to drain some fluid and allow the incision to heal. Are strokes and heart attacks common during and after this operation?
Select yes or no.
Correct. Anesthesia is now very safe. However, the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as strokes and lung problems. Are infections very common after surgery?
Select yes or no.
Correct. Infections are very rare. Though rare, infections as well as bleeding and scarring may occur. Paralysis, death, and bleeding are common after a transoral odontoid resection.
Select true or false.
Correct. Paralysis, death, and bleeding are not common after transoral odontoid resections. However, they could occur. The operation is always successful.
Select true or false.
Correct. The operation is successful most of the time. However, it may fail to improve the symptoms and may even make them worse. It is normal to have a breathing and a feeding tube after this operation.
Select true or false.
Correct. The breathing tube is usually taken out after the swelling subsides, and the feeding tube is taken out after the incisions inside the mouth heal.
Thank you for using Explain.